About how does one get to know that the blood supply to the legs has gotten affected, has reduced, and that is the cause of the non-healing of the wounds. There is a simple pocket Doppler examination by which a small little gadget as small as that can actually pick up blood flow over any artery in the body, which is palpable under the skin, जिसको हम हाथ से check कर सकते हैं. So this machine actually gives us a fairly good idea as to whether the blood supply in that particular area is affected or not. इसके साथ साथ we also do what is called a color Doppler examination or an ultrasound Doppler examination. This ultrasound Doppler examination gives us a very good idea as to where exactly the blockage is, how long the blockage is, whether it is a complete blockage or a narrowing of the artery, and whether there is one, two or more blockages. So this ultrasound Doppler examination is something which can be very easily done in very many ultrasound centers, and it can give you a whole lot of information about the actual cause of this arterial blockage. Once we identify that there is an arterial blockage on the basis of the ultrasound Doppler examination, we have to now confirm this diagnosis either with a CT scan, a angiography, which is a colored X-ray of the arteries of the body through a CT scan, or doing a direct angiography such as the one which is done for the heart. You all are aware of the angiography which is done for the heart. That checks out and lets you know about the blood supply to the heart. So when we do a leg angiography, we actually check the blood supply to the legs. And this will tell us where exactly the blockages are. If we diagnose and detect a blockage, this artery or this blockage has to be opened up. Unless we open and restore the blood supply in that area, the wound is unlikely to heal. Opening up an artery is exactly the same way as it is done for the heart. For the heart, you actually balloon the arteries, open them up with a balloon, and then place a stent in that. A stent or a spring or a tube, a metal tube, which keeps the artery open. This is something which is inserted in the leg arteries as well, just as it is done for the heart, and this keeps the arteries in the legs open. This procedure, which is called angioplasty and stenting, can actually open up these arteries and keep them open till the wound heals up. These stents do not remain open for life. They do not remain open for 10, 15, 20, 30 years. They will unfortunately get blocked again, but hopefully by then the wound or the ulcer should have healed up. So don't expect that just because an artery has been opened up, it will remain open forever. These arteries will get blocked because don't forget, it is because the blockage is because of progressive cholesterol deposition in the arteries due to diabetes, which is something that you or no one else has any control over. So it's not that the arteries got blocked because the doctors failed to open them up and keep them open. It is because you yourself have a progressive disease which will eventually lead to blockages of these arteries. So once the artery is opened up, this will increase the blood supply and the wound should eventually heal up. After wound heals, what is to be done? I'll talk about this in my next video.